Right now, behind closed doors, 13 members of the United States Senate are negotiating a deal to overhaul our healthcare system without so much as a public hearing. Secrecy is wrong, especially when the nonpartisan Congressional Budget Office estimates that 23 million Americans and more than 28,000 North Dakotans would lose health coverage under the proposal that the House of Representatives passed. On today's episode of The Hot Dish, we'll be talking about how the Republican healthcare proposal would impact North Dakota and about actions the administration has already taken that are threatening higher premiums from families across our country. Today, joining me is Dr. Mary Wakefield, who is not only a great friend, but a North Dakota native. Until recently, Dr. Wakefield served as Deputy Secretary of the U.S. Department of Health and Human Services. Thanks so much for joining me, Mary. You are just, you're the pride of North Dakota. We just so appreciate everything that you have done for the state, your public service, but mainly we appreciate you because you have a really big brain and you're a great thinker. And so I wanted to just explore with you as somebody who kind of came out of what clearly was some challenges for the Affordable Care Act, now transitioning, how you see this transition and what you think is good about the Republican proposal and what you think will have a very negative effect on the quality of health care throughout our country. And so want to thank you for being the great expert that you are. First, let's talk about what Medicaid expansion has meant, not only to the rest of the country, but North Dakota. Have you had a chance to take a look at this new bill that would not only change Medicaid expansion, Mary, but would also dramatically affect Medicaid as we know it by providing for a per cap or, block granting the dollars back to the states?
Well, right. And let me say, first of all, thanks so much, Senator Heitkamp, Heidi, for having me on today. And also, thank you so much for your interest in ensuring that North Dakotans have access to affordable and quality health care. That's always been a big priority for you. And I appreciate it as a North Dakotan, and I also appreciate it as a nurse, that you pay a lot of attention to ways that we can all work together to improve access to affordable health care. You mentioned Medicaid programs specifically, and there are major provisions in the bill that was passed by the House of Representatives. Some of these provisions, I understand, are also being deliberated right now in the Senate by that small group of individuals that you mentioned earlier. The Medicaid program itself, as you and people who are listening know, it's a bedrock program. Medicare and Medicaid are two long-standing programs that have ensured access to health care and so access to health for millions of Americans and scores of thousands of North Dakotans in particular. They're bedrock programs that the public highly supports historically, and they have a major impact on whether or not people have access to health care services. So what's in the proposal so far? Well, the bill that was passed by the House of Representatives makes a couple of very radical changes. It makes a number of changes, but a couple of very radical changes. One, as you know, North Dakota is one of the states that expanded Medicaid. That was great from my perspective as a North Dakotan and my perspective as a nurse, that the state pushed forward and took advantage of the opportunity to expand Medicaid so that more North Dakotans could get access to health insurance and then get access to health care. But that Medicaid expansion that was allowed by the Affordable Care Act and that states could participate in, North Dakota selected to do that, that expansion is cut. The House bill does not protect Medicaid expansion. It effectively ends Medicaid expansion. It slashes federal funding, and because of the steps that because of the provisions in the bill, it's expected that about 14 million people will lose their Medicaid coverage. And so you think about a state like North Dakota. Okay, what can North Dakota do if Medicaid expansion is slashed through the bill? The option is for North Dakota to continue to provide those health care services by covering the costs of that program. But this is a state that has had some budget problems and some budget shortfalls. So to shift the costs over to the state of North Dakota to allow the continuation of those new services that are being made available through that expansion is a really tough pill to swallow for the state. The state could choose to drop the expansion, cut Medicaid eligibility, and even if in their heart they would want to retain it, the cost of it is so significant, and it's the cost that's being borne by largely by the federal government right now. So that's one real problem.
Mary, can I just add something to this, because I think a lot of people are under the impression that this doesn't affect me, and oh, by the way, these are people who should just get a job and then they'll get health insurance. I've seen numbers as high as 93% of every person on Medicaid expansion in North Dakota is already working. They're working in jobs that don't provide health insurance, or they're not working enough hours to get a job that provides health insurance. And when people say, how will this affect me, rather than just those 28,000 people who have accessed Medicaid expansion, the other answer is a lot of the folks who are on Medicaid expansion are now on a managed care. So if they have a chronic disease like diabetes, they're seeing the doctor more regularly. It's avoiding visits to the hospital, admissions to the hospital. They're living healthier lives as a result of access to health care. But if you take that away, it will drive up health care costs. And if you take that away and they're forced to then move to the individual exchanges with chronic conditions, it will drive up premium costs on the individual exchanges. And so, when people say, well, this doesn't really affect me because I'm not a Medicaid recipient, the answer is, number one, you probably have someone in your family who is. But equally important is you also will see costs of health care go up, because we will not have people in managed care conditions, or we'll have people accessing the individual marketplace with higher risk factors driving up premium costs on the exchange.
Well, that's right, and it's such a good point. For the folks who lose Medicaid coverage because of the rolling back of Medicaid expansion, that those people who have jobs, low-paying jobs in some cases, or jobs without health insurance coverage as a benefit, those individuals that are lower income, folks with lower incomes, their only alternative might also be to, depending on their income, may also be to go without insurance coverage at all. And historically, in rural areas, we've had a higher rate of people who are depending on and using Medicaid program in order to get health care services. That's rural versus urban areas tend to have a higher proportion of people who rely on Medicaid. They've got jobs, they're low-paying jobs, and they don't have health insurance coverage as a benefit. To your point, you also mentioned the bill's impact on the Medicaid program itself. So if you set aside the Medicaid expansion that the Affordable Care Act made possible for states that chose to pursue it, the bill also makes very significant changes in that bedrock program, Medicaid. And in that case, the challenge there is that the plans, the House Republicans' plan puts a cap on the amount of annual federal funding that can go to states to support access to health insurance coverage through the traditional Medicaid program. So in other words, the bill does not protect. It, in fact, allows a reduction in health insurance benefits for people who have traditionally benefited from Medicaid. Those are seniors, their children, their North Dakota families, their individuals with disabilities. And so the cuts jeopardize the health of people who have been able to get insurance coverage through Medicaid expansion. It also jeopardizes many people because of the caps that would be placed on what the federal government will pay it jeopardizes access to health care insurance for people who have been on Medicaid.
Yeah, I just want to make a couple points about, just kind of common sense points when people say, well, what is the effect of this? If you take a look at the Medicaid expansion, which provider network in North Dakota, whether it's hospitals or doctors, will tell you is absolutely critical to maintaining their bottom line. It's over $200 million a year. If we get rid of Medicaid expansion, it doesn't mean that those costs go away, because there will still need to be health care, and it probably will be more expensive, and it will basically move especially our rural hospitals in the direction of bankruptcy. And if they can't, no one can keep their door open if you're running in the red year after year. I think the other thing is when people say, well, this whole idea of the shift of Medicaid from the states or from the federal government back to the states, the projections are as high as $830 billion over 10 years of cost shifting. I don't think any of us really should be under any illusion at all that states will be able to save $830 billion. And so either one of two things, either the state taxpayers will incur those costs directly, or in fact, we will see those being uncompensated costs. Now, I also want to make the point that when you look at Medicaid expansion and how critically important it is to maintaining good health in our communities, and it's an experiment that has been really well received among all the provider groups, is probably the most popular piece of the Affordable Care Act, and it's not something that we should easily unwind. When we look at Medicaid itself, so many of the recipients that are so concerned right now are moms of disabled kids who just need a little bit of help so that they can keep their child at home, and that's not going to be available to them. And so we're going to fight with everything that we have to maintain the Medicaid program. I think another big question that I get, Mary, that you can help clear up is how will, in fact, this repeal effort that passed the House, how will it affect pre-existing conditions? We have, potentially 300,000 North Dakotans that have what we would call pre-existing conditions. I would be one of them as a breast cancer survivor. Would I have the guarantee that I have today that the insurance market would have to take me with a pre-existing condition if the Republican plan passes?
So today you have that guarantee. You cannot be excluded because of a pre-existing condition from health insurance. That protection that is embedded in the Affordable Care Act right now goes away. So that protection is not maintained. And Heidi, as you know, and your listeners know too, everybody probably knows someone with asthma, diabetes, high blood pressure, cancer, and so lots of people have and suffer from pre-existing conditions. Lots of people in North Dakota with various healthcare problems. As a matter of fact, in rural parts of the country, we see a much higher prevalence of chronic healthcare problems even than in urban areas. So you can see this potential for disproportionate impact. Well, the bill would allow insurance companies to charge more for people who have healthcare problems, those pre-existing conditions. And that's right when the very people who want to stay healthy as possible and effectively manage their health conditions, all of a sudden allowing insurers to charge those people with health problems more or significantly more, that's a big step backwards. And so that too frequently can put health care out of reach, I would say, just when people need it the most. There's not one of us who knows when we may develop a serious illness. It could be a month from now or a year from now. So that protection, that consumer protection, is important for all of us, and it is substantially weakened. Bottom line, North Dakotans with pre-existing conditions that would be trying to get health insurance coverage could be charged unaffordable prices for that coverage. So it is a clear problem, and that was a practice that was used by insurance companies many insurance companies prior to the Affordable Care Act.
When we look at the exchanges today, and this is going to maybe switch gears a little bit, one of the concerns that I have is that very many of our young families, Mary, on the who don't get their insurance from the workplace, but get their insurance on the exchanges, that the products on the exchange, including in North Dakota, seem to be, very high deductibles, very high premiums, and that the exchange, the individual marketplace, isn't really working for young, healthier families. And I think that's a concern that we need to address as we're looking at repairing the Affordable Care Act, as we look at making this work better. And there's been a number of really interesting ideas, one of which was Lindsey Graham's, incidentally, where he said, let's take people with chronic, 4 or more chronic conditions. If you're a patient with 4 or more chronic conditions, the health statistics will tell us that 40% of all healthcare costs in the United States are the result of patients, the 14% of patients who have 4 or more chronic conditions. We know that people on the exchanges who have chronic conditions don't always get the managed care that they need to, because the insurance industry will tell us that the average time in a premium product on the exchange is 9 months, and that's just not enough time to go into the kinds of long-term investments in healthcare and wellness that will lead to a reduction of costs. And so one of the ideas is you take people with chronic condition and you drop them out and you put them in some kind of managed care, and not the high risk pools that we're talking about in the Republican rewrite, but something like that, where we would help subsidize, and that would lower the cost for on the risk pool, the individual insurance market, for people who are younger and healthier. I mean, when you were with the administration, did you guys talk about any innovative ideas that you could deploy that would actually reduce costs for young, healthy families so that they didn't incur all the risk of the insurance pool?
Yeah, such a great point, because this is, from my perspective, what we all should be thinking about is how we can improve on the provisions and the programs that we have right now, and basically do no harm. Make sure that we're not decreasing people's access to health insurance coverage or decreasing quality of health care, decreasing affordability. So anything that we're looking at should strive to improve affordability, access, and quality. That's, to me, the minimum litmus test. With regard to strategies to help bend the cost curve, because you're right, we need to continue together to work to find ways to help to drive healthcare costs down and to make it more affordable. One of the parts of the Affordable Care Act that was stood up was the Center on Innovation, and it exists inside CMS, but the Centers for Medicare and Medicaid Services. The resources flow, though, out to healthcare systems across the country to test and model new strategies for improving the care that people receive who have chronic conditions in particular. So we have not begun, I think, to really look at effective ways to deliver health care so that working in partnership with families, young families, and elderly too, all the entire age spectrum, to look for those new ways of working with people using technology, really engaging people in person-centered and family-centered care that is not as fragmented as we all grew up with, that is more comprehensive, and that meets the needs that patients identify for themselves. There are models that have been studied and that have been found to be effective, and so we've got some good investments already in the country that have been driven out of the private sector and also, as I mentioned, out of the public sector that are showing improved patient outcomes and also decreasing healthcare costs. We've had some good success stories, and we absolutely need more of those. I'm delighted to hear that you're thinking in that direction, because you were right earlier. We don't have a perfect, the Affordable Care Act was not a perfect bill. This was really about looking for opportunities to improve and build on the achievements that we've had. And one of the areas to do that, I think, is exactly in the area you're focused on, improving the quality of health care that people receive while driving down health care costs, making it more affordable.
Right. I mean, I just think that there are so many innovative ideas that we could be talking about if we just check the politics at the door, quit talking about, kind of who's going to win the political argument, and start talking about what we need to do to provide health insurance and quality health care for the people of this country and the people of our states. And we know that one of the biggest challenges is actually providing that health care in rural America. Mary used to be the head of the rural health at the University of North Dakota. PhD nurse who knows well, not only from the public policy side, but from the hands-on what it takes to deliver quality health care in rural communities. Mary, you are just you are really one of my favorite North Dakotans because you're not only smart, but you're compassionate and you're willing to listen to any side of the argument and come up with solutions. And so I think anytime you want my job, Mary, just let me know. You can come back to Washington.
No, thank you. I want you to continue to work as hard as I know you are. You're still young, so you just keep pumping away those hours.
Only in Washington, D.C., Mary, would somebody over 60 be considered still young.
You are, and you've got, thank goodness, a lot of energy still to bring to the table. So I'm delighted to have the chance to talk with you about it, and I did just want to add that your comment earlier about rural hospitals and the adverse impact on them. People know, they have traditionally operated. Our North Dakota hospitals have traditionally operated on pretty thin financial margins. What's been great in states that have expanded Medicaid is that they have seen a significant drop in the number of people coming through the door who are not able or who don't have health insurance coverage and who are unable to pay for the care they receive. So, and that makes all the difference. That keeps those doors open and those hospitals open for those hospitals that everybody in a community is using. That allows them to hire more people.
It prevents that hospital from shifting that cost to other people. And to other in the insurance market or otherwise. And so we hear numbers as high as it used to be 20% uncompensated care down to like 2 or 3 now. You can't beat that. And so
no, you can't. That's money in their pocket that they didn't have before and that they're able to use to develop new programs potentially, to pay salaries for people from the community who work in those facilities. The economic health of hospitals has been really, really challenged, and this is now providing an infusion when people who come through their doors of hospitals and doctors' offices are able to pay for that care with the insurance that they have, whether that's Medicaid expansion or marketplace coverage.
And I think another point, not that the point of this whole thing is employment, but the health industry in North Dakota is a major employer. And so cutting these benefits and cutting health care reimbursements from the federal government will have a dramatic effect on employment. One of the urban hospitals, when we said, what happens if Medicaid expansion goes away, he said, we'd have to lay off 200 people in my hospital. Number one, what does that do to quality of care? And number two, that's 200, hardworking North Dakotans who are doing a job that needs to be done, which is taking care of the health care of people. And so we're on it, Mary.
That adverse impact you were just talking about, it affects North Dakota families. It affects North Dakota's healthcare providers, both of them. And it's the reason why you see major organizations like the nursing organizations, the medical associations, family physician organizations, American Cancer Society, AARP, all coming out expressing serious concerns about these provisions, especially the impact on the Medicaid program, but not just that. So these are healthcare providers who have not had an opportunity to testify. They're consumer groups that have not had an opportunity to participate in hearings because none were held, who have expressed every other way they can very strong reservations and concerns about the impact that this has on the health of individuals and families. So I'm so pleased that you're paying attention to it, Heidi. Thanks so much for doing that.
Yeah, I think it's fair to say that it is absolutely the single biggest issue behind what's happening right now in farm country and the drought that we need to pay attention to, not only for the health care of our citizens, but the economic health of our state. Thanks, Mary.
You bet. My pleasure. Thank you so much.
We'll see you back in Grand Forks. Sabrina Corlett is a professor at Georgetown University and an expert on health insurance markets, which is an incredibly complicated area. I am so grateful that she's here to explain to our listeners on how the uncertainty that's being created right now in the marketplace, how we could actually attack that uncertainty, and why it is that it seems like the administration isn't implementing the Affordable Care Act to avoid the uncertainty. And that certainly is going to have a dramatic effect on health insurance premiums, not only in the country, but really across North Dakota. So, Professor Corlett, thank you so much for coming in.
Oh, it's a real pleasure. Thank you for having me.
Over the last several months, there's been a lot of news about insurance companies pulling out of state insurance markets and basically saying we can't afford it. That has led to a lot of claims that the private health insurance market is exploding, and that it's proof positive that none of this system actually works. Can you tell me where this uncertainty is coming from, and really explain how it is that we've gotten from A to B and why this is happening right now?
Yeah, well, the one analogy that might help is it's the kind of thing where if you have a house with a leaky roof, the solution is to patch the roof, not to burn the house down. Mm-hmm. And what we're seeing on the part of this new administration and many in Congress is sort of, well, we've got a leaky roof, so we've got to just tear the house down or burn it down. So essentially, I think nobody would say that the marketplaces under the Affordable Care Act were working perfectly. They were working actually pretty well in North Dakota. They have been. But in a lot of places, insurance companies were losing money. Some insurers were saying, this is a difficult market for us, and some were actually leaving. But there's a lot of evidence that going into 2017, just this year, the markets were starting to stabilize and correct themselves. Insurers were starting to learn more about the people that were coming in and how to care for them. And so Wall Street analysts, folks that were looking at the financials as well as the enrollment picture were saying, okay, we're not there 100%. This is still a new market, but it's starting to stabilize. Mm-hmm. Well, then we get statements from the congressional leadership and others about the Affordable Care Act repeal, threats from the Trump administration to cut off these critical subsidies to lower income enrollees that really help keep the markets afloat. And also, while it is unpopular, the individual mandate is a critical piece to getting healthy people enrolled and into the market. And the risk that might go away or not be enforced is keeping a lot of insurers from participating.
And it might be enforced at the same time that there remains the mandate for pre-existing conditions.
Right. I mean, when you think about it, right, the insurance companies kind of made a bargain with the government. Right. We'll take people with pre-existing conditions and cover them, but in exchange, we're going to have an individual mandate so healthy people come in, and then we'll have these subsidies. Mm-hmm. Well, if you threaten to take away the subsidies and the individual mandate, well, no, why would an insurance company say, that's a good bargain for me?
Well, it's interesting because we've had a number of insurance companies that have basically said that this uncertainty is exactly why they're pulling out, and the unwillingness of the administration to honor the subsidies and pay the subsidies is exactly why they have problems in the marketplace. And so it's not like we're inventing this. A lot of people are looking at the individual marketplace saying, look, we have challenges. And one of those challenges is that, you take all comers, which means, and then you've rated it 1 to 3, which mm-hmm. means that older, sicker folks get a pretty good deal, but younger, healthier people remain really challenged mm-hmm. in terms of, and we can't ignore that. That's a piece that I think if there was one thing that I would tell you doesn't work well for young, healthy families mm-hmm. Because they end up with an unaffordable product with really high deductibles. And that is kind of unfair that they're bearing more of the cost of what's happened. And so we look at this whole area and say, look, the last thing that we need to do is destabilize the individual marketplace while we're trying to fix it. And the cost sharing subsidies are a critical part of this. And we've seen, including in North Dakota, insurance companies actually suing the federal government. So maybe you can talk a little bit about what these cost sharing subsidies are and how that subsidization actually helps the marketplace work better.
Yeah, absolutely. So there's actually two kinds of subsidies that are involved here. One is the premium subsidy that for folks who are low and moderate income helps lower their premium or limits the amount they have to pay in premium. The second, which is a really critical subsidy, is this cost-sharing subsidy. And as you just mentioned, in a lot of these plans, the deductibles and the cost-sharing can be really high. But if you qualify based on your income, these cost-sharing subsidies will lower those deductibles for you. And the problem with the Trump administration threatening to cut those off is that the way these subsidies work is that if a consumer comes in and buys one of these low cost-sharing plans, the insurance company has to provide it under the law. Mm-hmm. And then the government steps in and says, we'll pay you, we'll compensate you for that. But if the insurance companies have to do this and then they turn around and they're not going to get compensated, they could lose millions and millions of dollars.
And they have.
And they are really worried about being on the hook for this. And it's a promise that the government made that is now being threatened to be rescinded. So it's a problem.
Yeah, I think that we've been waiting to see the outcome of the litigation. Which is House v. Price. It changed its name now with the new head of HHS. But I think that that's the pressure point that the administration is putting on the individual marketplaces, and it's really cynical because it's like, why would you threaten what we currently have? At the same time that you are in fact replacing it, if that's your goal, and the concern that I have is don't threaten people's lives and livelihoods and their access to health insurance so that you can prove a point that that may not be consistent with your kind of narrative over here. Make sure that this works how it needs to work for 18. Because you haven't gotten a product or you haven't gotten a health insurance reform / repeal passed yet, don't disrupt this. And I've heard from many, many insurance companies who have come darkened my door saying, what do you want us to do? We feel an obligation to carry coverage. We want to do this, but we cannot, given our fiduciary responsibility to our shareholders, we can't take this level of risk without knowing. I mean, that's basically what it comes down to.
Yeah, no, and I'm really glad you brought this issue back to the people who are enrolled in these plans and depend on them for access to care and services and financial protection. And so here we are where this issue has become this political football or a bargaining chip. And the people caught in the middle are folks who depend on this coverage. I've just never seen anything like it.
What do you think is going to happen with the litigation? Do you think that the administration is going to be compelled to pay these subsidies?
Well, one important thing about the litigation, as you may know, is the administration has asked for a delay until August 21st for that. But the problem with that is that the insurance companies have to lock in their premiums by August 16th. So if they don't know before then what the outcome is, that's a big problem. And most insurers will tell you it's about a 19-20% premium increase that they will have to put in place if they don't get those subsidies.
I think you need to repeat that because I think people will see this and say, "Oh, this is all a result of Obamacare." But at the end of the day, there was a mechanism in there to try and make these products more affordable. But it's not working because it's not being implemented the way it was intended.
That's right. That's right. Just the threat that these might be taken away is making insurance companies increase their premiums.
Or pulling out.
Or pull out. And no insurance company wants to increase premiums so high because they know that the more they increase premiums, the more healthy people drop out of the pool. And they want to keep those healthy people enrolled.
Yeah. No, you know what's interesting is that when you look at the proposed replacement plan in the House of Representatives, so their solution to eliminating the individual mandate is that they are going to charge you more if you come back into the private insurance market. So I think it was like a 30% penalty. So you would get your premium cost plus 30%. And I kind of smiled because I said, so if you're healthy and you don't need insurance, why would you go back in if you're going to be penalized? But if you're sick and you need insurance, of course, that 30% will be, that's just, the cost of getting health insurance when you desperately need it. And I think no one thought this is a disincentive for healthy people to come back into the exchanges, if they've had a lapse of more than 60 days. And those are the people you want back in the exchanges, the people who will help carry some of the risk of the older, sicker people. In your expertise, when you look at this, obviously a big component of the whole healthcare bill, the Affordable Care Act, has been Medicaid expansion to take people with maybe more chronic diseases, put them in more managed care, take them off the risk pool so the individual marketplace would work better. If, in fact, we eliminate, let's say, Medicaid expansion, moving literally millions of people into the individual marketplace, what do you think will be the net effect for healthy younger people if that happens?
Well, we know that in states that did implement the Medicaid expansion, the overall marketplace, the folks that are in the private coverages, it has generally meant that pool is healthier than in states that did not expand Medicaid. So if you end up with a lot of people off the Medicaid rolls, that will just mean a sicker risk pool in private coverage and higher prices, ultimately.
Right. And so people who don't have health insurance, except for the individual marketplace, will end up bearing the cost of older, sicker people who would otherwise receive Medicaid, coming back into the individual marketplace. It's you got to think about all of this, I think, from the standpoint of a balloon. If you push on one area, it's going to pop up someplace else. And I think our overall goal should be to reduce healthcare costs writ large. But in order to do that, we know that the innovations that many insurance companies and many providers are driving is this idea of getting people into managed care. The insurance industry has told me that the average time on an individual product on the marketplace is about 9 months, which really limits the ability to do that cost reduction. And so if we can stabilize that individual marketplace so that people who go on the marketplace or go in the individual exchanges actually reduce costs, there should be a huge benefit for everyone in reducing healthcare costs, because all of our premiums will come down, whether you're employer-sponsored or whether you're buying that insurance for yourself. That's just the reality.
That's absolutely right. But I will tell you, there is nothing certainly in the House-passed repeal bill that would address what I totally agree with you is a fundamental challenge for why healthcare is so expensive in this country, and in fact would probably make it worse, because if you're uninsured, you're not getting any care, let alone managed care.
Right. We were talking earlier with Mary Wakefield that the new study that came out that said 40% of all healthcare costs goes to deliver healthcare to 14% of the population. What is unique about that 14% of the population is they usually present with 4 or more chronic diseases. And we haven't even gotten into what behavior and mental health will mean. And, I was talking to one of my providers one of North Dakota's great healthcare providers in Dickinson, who told me that in his hospital, he sees about a 15 to 17% Medicaid population. And so about 15 to 17% of his patients are Medicaid eligible. But when he looks at behavior and mental health, it's about 70%. And so if we take away healthcare coverage to the 70% by eliminating Medicaid expansion or monkeying around with traditional Medicaid, and we say, okay, you're no longer going to get healthcare, they're going to fall into the private insurance market, driving up costs even more.
Well, not only that, and I'm really glad you mentioned the mental health issues, but also substance use disorders. One of the things the Affordable Care Act did, of course, was that mental health parity requirement that said insurance companies have to cover mental health and substance use treatment at parity with medical. Well, that's now at risk, right? Because if you roll back the benefit standards, which the House bill has that option for states, you could have a lot of people who just can't get mental health coverage at any price. And that's just
I think it's
foolish.
interesting that when people say, well, none of this will affect essential health benefits because, we didn't repeal that. But what they did is basically say the states can, and until you ask your state, are you going to maintain those benefits and put it in state law? You have to be honest and say that benefit's at risk, whether it is pre-existing conditions, whether it is parity for behavior mental health, whether it is not charging women more on for insurance than men of the same age, and so it's a complicated business. There's no doubt about it, but it is. It is not something that should be changed in the dark of night. It's something that we should have opportunities. And what's been frustrating for me, honestly, is I get calls saying, how will this affect me? And I go, I don't know because no one's told me what it is. If I could see it, I could tell you, but I can't tell you what it is. And I think the American public is not being well served by not having a discussion of this out in the open. I'm sure, that's my editorial comment for the day, Sabrina.
I would love to see the bill, too. I certainly hope there's enough time for public viewing of it and hearings and markups and a chance for people to really understand what's in it before you have to vote on it.
Yeah, I just think this isn't the way to run the railroad. But, I'm new here and... And I come with a kind of common sense North Dakota approach, and it just seems to me that if you are dealing with one of the most critical parts of someone's life, which is their health care and their health insurance, there ought to be the opportunity for examination. And the promise, I just kind of tell people, if you take $800+ billion out of health care, out of Medicaid, and say there won't be any effect as a result of that, you cannot honestly believe people will believe that, right?
Right.
And
cutting the marketplace subsidies practically in half.
Right.
And that's less money for people to afford coverage with.
Right. And like I said, there's things that I would love to fix, which is, I think younger, healthier folks can't find affordable products in this country. We need to fix that. I think that the cliff events that happen with subsidization are not good, where somebody says, well, if I work that extra hour or 2 hours, that means I lose my subsidy and therefore I can't afford that. We need to figure that out, how we don't disincentive work. I get it. I get all the concerns, and I get the, we don't like the mandates. We just need to understand we're in this together, and there's going to be a way for us to work this out if we would just check our ideology and our politics at the door, put on our thinking caps, and really be honest about what the problems are and what they aren't. And Medicaid expansion is not a problem.
Yeah, absolutely. I think once you dig past the rhetoric and, like you said, the ideology, there's actually a lot of common ground that could be reached. So in many ways, that's sort of the tragedy of the process that we're going through now.
It is. Anyway, thank you so much.
It was fun.
Dr.
Thank you
Collette.
for having me.
I think we just need more people who are thinking about this, more people who are talking about it, and this is a great opportunity for people to understand kind of where I am right now, because this is pretty important. But also what the thinking is on what we can do and what we can't do. And to me, the rubber meets the road on Medicaid and Medicaid expansion. Absolutely. And any rollback of those programs for me are really non-starters.
Yeah, well, I look at a state like North Dakota, and you guys don't get enough attention because you expanded Medicaid, and you had both. That was bipartisan in the state. You've had 3 strong carriers in your market that are sticking with it, and your rate increases were incredibly low. So somehow, I don't know whether it's North Dakotan common sense or what, but you've made it work.
Well, and I think we're going to see some higher rate increases right now because of this uncertainty.
Sure.
And want to make sure that my insurance providers don't get hit with a lot of criticism, because folks need to understand what they're up against. But at the end of the day, when I ask my healthcare providers, how can we do this smarter, better, and provide quality care, they're always stepping up. We're looking at regulations that don't make a lot of sense, that don't add patient value. We're looking at the different ways of delivering rural health care, whether it's telemedicine, but also looking at not doing bricks and mortar, but actually almost that doctor, house call kind of model that will provide ongoing care. How do you pay for it? I will tell you, my guys are so innovative. I'm so proud of the healthcare delivery that we have in North Dakota. As a breast cancer survivor, people would say to me when I was diagnosed, "Aren't you going, to Mayo Clinic, or aren't you going to, Dana-Farber, or MD Anderson?" And I go, "Why?" Because people in North Dakota frequently don't understand how truly blessed they are with not only the access that they have to care and the easy access they have to care, but the quality of the care in our state. And we want to maintain that. We want to make sure that people have access to it, but we want it to be affordable for all of our families. Thanks so much for coming in.
It was a pleasure.
Thanks for joining me for The Hot Dish, and make sure to subscribe to The Hot Dish on iTunes so you don't miss an episode.